I'm Judy Alter. I'm 79 years old and I live in Fort Worth. I've been writing and publishing since the early 80s.
Judy Alter is an author whose specialty is mysteries.
I like the satisfaction. I like the fact that people enjoy my stories.
Recently, she'd been living a real-life mystery, one that got progressively worse.
I couldn't sleep for long on my left side because it would start to ache. I had back pain. I had low back pain, and it was bad. It hampered me. One of the things in life I love to do is cook, and I couldn't stand to cook. It hurt too badly. I couldn't even wash dishes.
After a misdiagnosis and misguided treatments, Judy was stuck in a constant state of excruciating pain. The mystery continued until she got an X-ray of her hip.
The cap and ball joint didn't have a ball. It had just disappeared, and the bone had gone up through the cap.
I'm just going to take it real gentle.
Judy consulted Dr. Jeff McGowan, an orthopedic surgeon specializing in joint replacement surgery at Texas Hip and Knee Center, a Texas Health Physicians Group practice.
I really don't know how she was surviving on her own. She needed a lot of assistance from family, it seemed, on the first visit in the office. This is Miss Alter's hip before surgery. The right hip's fairly normal with a normal ball and socket portion of the joint sitting at the right level. The left hip has the socket, but the femoral head is eroded through the roof of the socket. We have to come up with a solution to fit the problem. In her case, it's reconstruction of the joint, which was much more than a simple hip replacement. It required a very complex reconstructive procedure because she had excessive bone loss.
After the procedure, recovery time, and continued rehabilitation, Judy is back on her feet, pain-free.
I have a lot more mobility. My kids will look at me and say, "Mom, 4 months ago you couldn't do that." I just do a set of exercises once a day, plus I try to walk as much as I can.
Judy's doing a whole lot better than she was at the beginning. She's functional again, can walk, starting to get back to a normal life, and I think she has a very normal existence from here on out.
He's a technician. He knows what he's doing. He's good at it. I recommend Dr. McGowan because he's a skilled surgeon and he takes the time to study each case, apparently. He certainly did mine, and did not approach it as just another routine hip replacement.
Are you having any pain in the hip? I love my job. I get to practice medicine in a way that allows us to truly fix problems, not simply prescribe drugs or moderate a condition, but to really change it and have a positive effect on somebody's quality of life.